Good evening, everybody. Welcome on in. Welcome on in. Hope y'all doing well out there in social media land. I hope y'all got a little time for me today. I'll be on about an hour, a little bit over an hour, depending on how the breakdown of us talking and everything. But welcome on in to another episode of Medical Talk in Layman's Terms with Nurse Charlene, and I am the host, Nurse Charlene, and just getting on in here doing some medical podcasting for you guys and stuff. Let me put a couple people on real quick. So you good to go? Okay. Thank you, Mom. All right, y'all, and stuff. So let me get my cell phone so I can see what's going on too and stuff. All right. So now we set up. So basically, today's topic is called, and I want to quote it right. What you see on the board, that's some of it and everything and stuff. I have a ball just writing up all this stuff, but everything that you see on the board is what I'm going to give to you in bite-sized pieces and everything. So it's called, or the topic tonight is Our Amazing Human Body, a head to toe health blueprint in layman's terms, meaning keeping it simple so that somebody that knows nothing about medical stuff and all the mumbo jumbo, that we talk about and everything could understand and maybe even get some help before, it becomes too late. There's nothing else we can do about it. You have so and so amount to live, because you didn't go and get that screening or this or that and everything. So what I'm trying to do is bridge that gap so that we can start finding out and be proactive about our bodies. And even if we don't know everything they're talking about, because nobody will know every single thing and stuff, you'll know something. You know that you got to fight for yourself. You know that you got to fight for your family members, your health, and well-being and everything and stuff. So that's where this is all coming from. And definitely it's something that's needed. It's actually more essential than actually going to the doctor. Just to know that, yeah, go to the doctor. Go ahead and get this done or that done. How many times have we just wasted time and the quality of our life has went downhill because we're not telling on it. We're not, my business is your body's a snitch, believe it. Meaning your body tells on the inside, it tells on you the stuff that you can't see. Your body has a way and its subconscious of telling you, yeah, and it sends out warnings. If you ignore them, then guess what? It's just like ignoring a blinker. You in the car, you turn on the blinker to go to the left. If everybody ignored your blinker, including the person behind you, and then they run and smack you, or somebody else coming from the other way, see that you got a blinker on and they smack you and stuff like that, that means they were probably ignoring your blinker or ignoring the fact that they're behind the wheel, and stuff. So you gotta take your wheel, take responsibility for your will, which is your body. And so that's what I'm talking about, because I didn't gave you, I even wrote it down and stuff. I didn't gave you a few topics that I've taught on. This is only just a smidgen of what I've taught on, but high blood pressure, diabetes, stroke, how to spot a stroke, heart attack, substance use disorder. That means substance abuse, abusing drugs, abusing drink, abusing tobacco, weed, mollies, popping mollies, all of that stuff. Personal hygiene, that it's a real thing, to wash your clothes and to take care of your body and everything. Mental illness, what's going on in the nugget up there, and different things like that. The unhoused, I was corrected and stuff, and I'm glad that I was corrected, because guess what? I can still learn with 2 decades behind me of nursing, 2 decades plus, but 33 years in healthcare, period, and stuff. I can still learn to this day if you teach me. and everything. So that's where this is coming from and stuff. How to treat a caregiver, how to be a caregiver, how to act right, how to do right, how to make it happen. Autoimmune disease, cancer, marijuana, sex addiction, and risky behavior. I'm hitting it all. I'm hitting it all. It's no joke. I'm gonna start a movement, and I have a lot of doctors and nurses that want to come on here and they're saying, say the word, and I'm on, and everything and stuff, and I can make it happen and stuff. But I want to make sure that you guys are in tune so that you know that this is not just a toy I'm playing with, or just I want to be on. Yeah, I had to get over being shy. I had to get over having anxiety and having anxiety before I got on and everything and stuff, and not being able to talk and get, and getting tongue tied and all of that stuff to be able to bring this to you. I fought through all of that so that I could do this for, for you, for me and stuff, because I told you everything, every subject that I go over and I teach you and I research on and then present to you, I have to learn it too. So I have to learn it before I give it to you, but then also while I'm giving it to you, I'm learning even more and I'm picking up more. And then the interaction, because this is the interactive platform and stuff, that helps also, because then you're coming on, you're talking to me and stuff. I'm getting pumped up, and I'm, now I'm rolling. Now you can't even stop me, nothing could stop me, and stuff. I'm ready and everything. But that's where all of this comes from. So before I go any further into our topic tonight, which is our amazing human body, a head to toe health blueprint in layman's terms. Okay. And stuff. So I'm going to do my podcast disclaimer. And this is just to help, protect me, but help, keep me correct. And that is the podcast is for informational and educational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your physician for any medical concerns. Okay. If you have questions about a medical condition, reach out to a qualified healthcare professional, your doctor. Never disregard professional medical advice or delay seeking it because of something you heard on a podcast. Because I got tired of saying on this podcast, it's all podcasts and stuff. Always seek a medical professional's help first. And then, you can have this to kind of finesse what you already know. But use them to help you get to the good part. And then guest views are their own and may not reflect the views of the host, which is me, or this podcast. The information shared is for general knowledge. It should not be used for any legal or medical purposes. Always consult with a licensed professional who knows your medical history for a meaningful evaluation. Stay informed, but always seek professional advice when it comes to your health. Okay, you guys? Get to the professionals. They, like I said, them doctors, they didn't spend 800 years in school, since they were Doogie Howser age. I don't know if you guys remember that. I might be dating myself. But anyway, they spend all that time learning and trying to figure it out. And you just gotta know that a doctor doesn't know you. He gets a patient and he accepts your insurance or whatever and stuff. That's about as clear as it is. He knows that it might be a 41-year-old male, or something like that, or a 21-year-old female, and stuff. He doesn't know you. He doesn't know your mother, your father, your sister, your brother, and all of that stuff. He knows what you tell him. So a doctor is not nosy. A doctor is like, when you see these CSI shows, these cop shows and everything, they have to go and knock door to door and canvass the, area and stuff because it was a murder down the street or something like that, and whatever that, entails and stuff. So they have to pick up intel. They need information. So that's just like a doctor. They don't know you. What skin in the game do they have to serve you? And you don't want to tell them nothing because they too nosy. Yeah. And when they too nosy, they ain't gonna do nothing for you. They're gonna see what you about, and they're gonna pretty much refuse to take care of you and everything. So welcome on in, Rosie Granny Allen. That's my mommy. I love her so much. And Brittany Scott, that's my baby girl. And I love her too. Y'all welcome on in and stuff. And everybody come on in and stuff. I can't see everybody yet, but I'll see what's happening. I'll keep on checking on it and everything. But yes, in the meantime, y'all come on in and stuff, and don't be afraid to talk and stuff. This is a non-judgmental platform. It's a safe space. I tell my business sometime, a little bit about me and stuff like that. And there's testimonials and different things like that. And the people, I pride myself on keeping them safe, and everything, and their information safe and everything. So without telling their name and birth date and all of that stuff, sometimes we'll talk about it like, oh, I had a stroke too, or oh, I had this, or something like that. And it's just that I tell them, anybody that's brave enough to come on and say their piece, or say what they feel and stuff, if you're brave enough to do that, somebody else is not that brave this time, or maybe last time or something, and then they come on now and they say something, or they add to the discussion and everything, and it's appreciated and it's welcome and everything. But you'll see how it goes as we get along and get on with this and stuff. So I'm gonna just go ahead and start on in. So for today's topic and everything, my purpose is to help everyday people understand how the human body works from head to toe, what each system does, how to keep it healthy at every age, clear up common myths, and leave with practical take-home messages. So that's my goal and stuff. If it sounds right and stuff, you at the right place and everything. So I'm gonna start with the first one that we talk about. We're gonna go head to toe, and pretty much that order. It might get a little left or right, but head to toe. Okay. So then we got the brain and nervous system. It's called the control center. The brain and nervous system. That's what I'm starting with. It's a head to toe, just overview of your body and everything. So it goes like this. The brain and nervous system are the body's command center. They control thinking, memory, movement, emotions, breathing, heart rate, and pain. Pain is a thing, okay? The spinal cord and nerves act like electrical wires carrying messages throughout the body to move. That's what it does, okay? And how do we keep it healthy? Well, I'm glad you asked. Okay, how do we keep it healthy? By trying your best to sleep 7 to 9 hours. That almost probably sounds impossible to other people, but sometimes when are you going to prioritize yourself and everything? When are you going to put you first, and stuff? No, we always think, if you're spiritual, we put the God of our understanding first and everything and stuff. But sometimes in between that and stuff, it can get a little mixed up and everything and stuff. So what I'm saying is you got to put yourself first as far as, anybody and everything, because if you're not here anymore, you're not here anymore. There's never another you. That's what I try to say and stuff. So sleeping 7 to 9 hours. I know that sounds weird, but how about you try sleeping that? So that means putting down that phone, not being on social media, and stuff, not doing all those little things that can wait till tomorrow and still get done, and everything. Welcome on in, Miss Sandra. Hope you're doing well and recovering properly. She said, hello, Nurse Charlene and Rosie and Britt. I am here from my hospital bed. All right and stuff. A warrior. She just had surgery if I can say and stuff. And she's recovering. She made it through surgery. It don't matter what happened or what kind of surgery, she made it and stuff. So welcome on in. God bless you. Okay, so the sleeping 7 to 9 hours regularly and stuff. Just work your way up if you're not there yet. But start at least at the 7, trying to get to the 7 and everything. So then also another way of keeping healthy, these are ways to keep healthy, and that would be manage stress. And you could do that through prayer, meditation, breathing exercises, and counseling. A lot of people, their stress is tied to their job, their money, their income, and everything. So they got to get the income. They got to have the job, and everything. But it's stress. I got to go and I need this check, but I got to go through all of this to get that check, and everything. So that's just stress in itself. So finding that happy medium. If it's really extreme, like I had for years, decades, had very extreme, high paying, but extreme jobs. And it's like, I always say this and joke around and stuff, but it's really the God honest truth and stuff. People say, "Oh, girl, if I got paid $100 an hour and stuff, shoot, I'll work 86 hours a day and stuff." And I said, "You'll be dead after about 1 to 2." Yeah, it's not for the weak and stuff, and that could be anything. It could be, like just any high paid job. Expect that. You got to breathe stress. You got to be able to take it on. It's that serious and stuff. So that's where that comes in at. Yes, yes, yes. I'm on line. I'm online. I'm online. Wow, wow. Thank you. I'm gonna remember. Okay, so managing stress through prayer, meditation, breathing, and counseling. Counseling meaning you're at your jobs, you got these high jobs and stuff. They also have these employee assistance programs and everything. So with those employee assistance programs, there's there's a situation where they give you a certain amount of hours. That's what it is. I was trying to come up with the right words for it and stuff, but they give you a certain amount of hours that you can have to have counseling, free counseling that doesn't go against your health insurance and stuff like that. But they get paid through this little pot of money to help you focus better on your job and focus better on your well-being and everything and stuff. And then they have good tricks for you to help lower the stress, because too much stress, I'll talk about it later. And so then you got another way to stay healthy is stay mentally active. That means actually reading. When the last time anybody picked up a book? I got books all around me, but have I picked it up, or have I picked up the phone because it's easier, and stuff like that. So that's where that comes in at. We got all these devices and everything, but actually not sleeping on the devices, especially those tablets and different things like that and stuff. You can actually read books via the tablet, or have the tablet read to you, or have your phone read to you and stuff. So it's other ways of doing it, but trying to avoid the scrolling, but put yourself in that place and stuff. I remember when I used to read books and adamantly read books and stuff, it was very soothing to me. It took me to the place where the book was, and I remember that from, elementary school, and the teacher reading these wonderful novels and stuff. And she would read, maybe a chapter, at the last ending of class and everything. And I would actually travel to wherever it was at and be in the middle of that. And it was fun and everything. So things like that, it is fun to read, to learn new things. Don't leave yourself just, sitting there. I don't know how to do that. I don't know how to play with all these gadgets they got and all of that. Don't get mad at them. Learn how to use them. And then once you learn how to use them, then you'll be like, what was I waiting for? and stuff. Yeah, it's weird until it's not, until they help you and stuff. It was weird for me to try to figure out the computer. I didn't like touching enter, on the computer. Now you can't keep me from pushing that every single day, enter and do this and put this in and put that in and everything and stuff. So it's very good and it's stimulating to your brain and it keeps you up on things. It keeps your brain fed. It needs blood and oxygen and nutrients, but it also needs reading and different things and learning and stuff like that. And conversation, decent conversations, listening to a podcast that actually helps you, not just any mediocre thing, but something that's going to put something into you that's valuable and everything. So then you got protecting your head, how to stay healthy to keep your body healthy and stuff. Protect your head, wear helmets. Even when you're skating, even when you're skateboarding, and stuff, anything you could fall and hit yourself, hit your head on a piece of cement or something like that and stuff. Sometimes if you clumsy, start wearing one while you walking around, you never know. You might need it, and stuff. I might need it, and stuff. But I'm saying that to say that don't sleep on the helmets. Also, seat belts. Girl, I'm just going around the corner. I ain't fastening no seatbelt. I ain't got time for that. And then you get T-boned and you fly out the window and stuff and you're dead, and stuff. It only takes 1 second to snap your seatbelt and 1 second to die, and stuff in an instance, and everything and stuff. So just remember, if I did all I could do and I still don't make it, then it was meant for me to go. But if I did all I could do and I saved myself that trouble, or that pain and anguish, and I made it and stuff, then that means that I was doing the right thing by having my seatbelt on. So that's where that comes in at. And then limit your alcohol and avoid drugs at all costs. Because what do? They get addicting. That's why they want to give you Narcan. Where is it at? They want to give you Narcan at, everywhere you go and stuff, and doing this and stuff. This is really a thing. And it's very popular because everybody doing drugs. They can't cope, and stuff. So they need that and stuff. But that's why I said avoid, limit alcohol and avoid drugs, and everything. They didn't say stop. But if you're a drunk or you're, welcome on in, Bo Love. You said, no, don't go, nurse. Okay. Yeah, exactly. And stuff. Don't go. I want to be here and everything. But definitely limiting alcohol. If you know that you drink too much, enough is enough and everything and stuff. But if you can't, start with just slowing down each day until you can get that, or get that help, and stuff. Not just with alcohol, it's also drugs and everything and stuff. You get into an accident or you hurt yourself or you break a bone or something like that, or really injure yourself really bad and stuff, and you got pain medicine for it. When that thing is over, you leave that pain medicine alone, because that's when we mess around and find out that we should have left it alone, because now you're picking up another addiction to soothe something else that was wrong with you and stuff. So it's definitely a problem. So then age groups and key risks for that particular age group. So children and teens, this is the time, for children and teens where their brain is developing. They're at risk for concussions, from sports and different things like that. And it's not to, put down any sport and stuff, because how do we get our NFL players? They had to start somewhere, and stuff. How do we get our Steph Currys and stuff? They had to start somewhere and everything. So the whole point is this puts them at risk and everything. And adults 20 to 50, and that would be So for the children and teens, it's brain development. This is when their brains are developing, and concussion risk. So for adults 20 to 50, it's stress. Like I said, those stressful jobs and stuff, and not seeking the right help for them and stuff, and you're stressed out. You want to knock somebody out at your job because they doing this, or your boss is no good, or so and such and such, or however that looks, however it looks, and stuff. Because it's two sides, and then it's the truth, and everything. But whatever it looks like and everything, this is what the adults 20 to 50 got to deal with. Going to those jobs, they got stress, reproductive times, anxiety, what else we got? Burnout, job burnout. That's a big thing. Being burned out from your job and stuff, to where you're not even productive anymore. You don't even try. You don't even come in here and put your stuff together and get excited and get on with the day and everything. Bo Love said, do you drink? I actually don't drink. Yep. No, sir, I don't drink and stuff. So then we got older adults. That's your 60 plus. And that is memory loss. Do I got dementia yet and stuff? Like what do I do? I looked all over for my keys and I couldn't find them. Well, sometimes it could be that day is so stressful, or you got to go to the doctor and you really don't want to go to the doctor, but you got to go and everything. So you get stressed out, and now you can't find your keys. And then you left the pot on the stove or something like that. So little things are like your bread crumbs that you need to watch out. You got to take care of yourself, and you got to tell on it. When you have these instances, when I bring my mother to the doctor and stuff, they got a history of telling me, has she fell in the last 1 to 2 months and everything and stuff. And so me knowing that and stuff, I'm paying attention and stuff, but I'm also trying to make sure I avoid that by giving proper medicine that will keep her equilibrium straight, and stuff like that. So I try to, forego the problem and everything and stuff, but just in case, I just don't take no chances. I'm always watching, and everything. So that's where it comes in, because these older adults and stuff, they got the memory loss. They could have a stroke. That's where you get rubber legs and stuff. Your legs can drop and you just drop and hit the deck, and stuff. Or dementia, which is Alzheimer's you're born with. It's it's in your genes or something, or you're born with it and stuff. Whereas dementia, it mimics Alzheimer's. All the things that Alzheimer's give you and stuff, that's what dementia is, but it's just the symptoms of it. So it's the snitch of it and everything, but Alzheimer's is the actual disease and everything. So myth versus fact. So I decided to just kind of hit them all as I go along, because I'm going from head to toe. So myth: memory loss is normal when you're aging. That's untrue. In fact, some slowing is normal, but major memory loss is not. So some slowing is normal, but memory loss is not. It's time to go to the doctor and find out why you're losing squares of time, different things, not remembering everything and stuff. Yeah, it's a problem. And you need to have somebody around you and stuff, and you need to go tell on it so that they can get to the bottom of it and find out, are you in a dementia state of mind and everything. So then myth: stress is all in your head. Stress is all in your head. Oh, it is actually, but no, stress causes real physical damage over time. Meaning, if you stay stressed out and you don't find an outlet, you don't find some type of healthy way of dealing with it, it's gonna break your body down. It's gonna start attacking other things. When it gets to run rampant in your body and stuff, it starts messing with your mental health, and stuff, and making your mental health a mental illness and everything. It starts doing things to you. You start, running into panic attacks. You start running into all these different things and stuff. So stress over time will cause a lot of problems. And that's from the brain and the central nervous system, which is your command center of your body. And the take home message: protect your brain. It runs everything: sleep, stress control, and mental engagement matters at every age. So even a kid learning how to talk, that's a big deal for them to learn that one little word and everything. And we got a little saying and from my mother and stuff in our household and stuff. And now the grandbabies are starting to say it, and some of the grandbabies are older and stuff. But it's my mother would always say, "Oh my God," and stuff all the time. And then I saw my son. He sent a little video and stuff recently to me, a little thing of the babies. He had it on the babies, and he said, "Oh my God," and the baby said, "Oh my God," both of them at the same time. And I thought that was so cute. But also my niece, she did the same thing. We were inside one of the little stores, Ross or something like that, and she was sitting in the she was about 3 years old, like them and stuff, and she was sitting there, and I could hear her say, "Oh my God. Oh my God." So they mimic what they think is important and everything. And then they try to do it and say it like you said it, and stuff like that. And just imagine when they find out that really means something. It means like, "Oh my God," like I'm shocked or something like that. And they say that and stuff. It's just the cutest thing, but they don't even know what they just conquered, and everything and stuff. So I'm saying all of that to say it's nice. And so we're going to move on. So that was the brain and central nervous system. We're going to eyes, ears, nose, and throat. So we've all heard, or maybe have heard of ears, nose, and throat, or an ENT, ears, nose, and throat doctor. And that's because they're all connected and stuff. But also all these things are the eyes, the ears, the nose, and the throat. They're called your senses. And so these organs allow us to see, hear, smell, taste, and communicate. They also help with balance and safety awareness. Okay. To keep them healthy, this is some things that you must do. Regular eye and hearing exams. You put your hand over your eye and say the letters, the first roll of letters, and so on and so forth, and all of that stuff. That really means something. It's somebody that went to school for a long time and learned all these little skills and everything in order to give you that eye test, that test, certain parts of your eye. How good can you see? How clear can you see? And stuff like that. So that's where that comes in at. That makes sense, right? And the eye, what is it? The eyes, ears, nose, and throat, the senses. Not only do they allow us to see, hear, smell, and taste and communicate, we got to definitely keep them healthy. So that's the exams and the regular hearing and eye exams and stuff. That's really a thing, and stuff. They'll do stuff and have stuff go in your ear and stuff. You got to raise your finger and stuff. And, every time you hear and stuff like that. And you never know, ringing in the ear, that's not normal. Plugged up ears all the time, and you don't have a swimmer's ear or something like that and stuff. That's a problem, and different things. And they all lead to not being able to hear. So that means you're losing one of your senses that you need. You need all your senses and everything. So then it says to limit the loud noise exposure, like having beat in your car and different things like that. Limit those things, those noises. Going to a concert and you sitting right by the speaker and it's blowing your ears up, and then you can't even hear for another day or two after that if you get your hearing back, and stuff. So being conscious of these things. Also wearing sunglasses when you're out in the sun. That's why they're called sunglasses, because they block the UV rays from damaging your eyes, which is a whole organ in itself and stuff. And they need to be protected. And if they can't be protected, they get corrected, sometimes. And sometimes you don't even have a choice. You inherited certain things and stuff. So that's where that comes in at. Also, avoiding smoking. Well, yes. If you smoke, a pack a day or something like that. I'm just coming up with anything random and stuff. But if you smoke a pack a day, and then somebody tells you you need to stop smoking, and stuff. Yeah, that's easier said than done, because I built up a habit. Nobody stopped me when I had my first cigarette. Second cigarette, three, four, fifth, sixth, seventh cigarette and stuff like that. So it was a habit built. So you got to build a habit of not smoking, not going to those familiar outings and wherever you were at and stuff, not going to the patio no more and stuff. Find something else to do with your mouth and lungs and stuff like that and stuff. Just, find a healthier habit, period. And everything. Treating sinus and throat infections, not just and stuff. Oh, what's in there? Yeah. I don't want to know. But anyway, saying all of that, I'm saying that treating that and stuff. We've all had it. We've all had that cough. We've all had that phlegm in the back of our throat and everything and stuff. We've all had these different things when we had a cold or bronchitis or whatever it might have been, COVID, and such and stuff. So attacking it early. Sometimes if a cold goes more than about 3 days and you're not even on the mend or something like that, you need to go to that doctor and tell them, I got this wrong, this wrong, this wrong, this wrong. Now they got other stuff like throat lozenges, Halls, cough drops or whatever and stuff. But those don't solve the problem of why you got it. They only soothe you and stuff. So another way of masking. But actually going to the doctor never hurt anybody and everything. So then the age groups, when we don't take care of these things and stuff, children, they could develop eye problem, vision problems, like they can't see. So you see somebody 6-year-old little boy and stuff, he got glasses on, really thick glasses and stuff. What happened? Is that some genetic, or is that some that that runs in their family, on the mother side, the father side, or something like that? Or where did it come from? And this is in children. Constant ear infection. Who hasn't had an ear infection as a child, or their children had ear infections and stuff like that? It happens, and everything. But getting to the bottom of why, especially if it keeps happening and keeps happening and keeps happening and stuff, get to the bottom of that and find out what's happening to make this, their body snitches too. They don't know their body snitching, but you'll know, if you're being observant and stuff. And then for adults with the same thing, screen strain. Like I'm looking at all of this stuff. I got lights on and different things, on me while I'm doing the podcast. But what if I was doing this 24/7, just sitting on, just hour after hour after hour? That would be a problem. It would be very, it would be literally a problem, and definitely something to worry about. And hearing loss, the same thing. Loud music, the club or whatever and stuff, or what, all these different things and stuff, that would be a problem, and stuff. Just being around that loud music. It could be at a stadium. We got the Super Bowl coming up and stuff. It's all these things and it's loud music and all of that stuff. Some younger folks, they work at Dave and Buster's or these little places, and all this music and all the little video games and all that, and it's all just going into your head, blowing your ears out and stuff. And let me see, Sandra said, how about anything that's a bad habit stop? I am one that had a bad habit of smoking. When I was told about my surgery, I stopped cold turkey. No more smoking for me. Amen. Amen. That you were strong enough to be able to do that. But I'm talking about also when you build a habit. Nobody is asking you to stop cold turkey. Now that's just gangster, to me, when you could just stop cold turkey and stuff. But if you're not able to, I'm not telling you how to stop. I'm telling you that you can build up to it and get there and stuff. And sometimes you just know that it's better if I value my life, it's better for me to figure it out and stuff. And so congratulations, Sandra, you figured it out and stuff. You just had to stop and stuff. It's no down put to anybody else. Anybody else, take your time, but just make sure you working on it and stuff. So that's where it's at. Good work, Sandra, and stuff. So then the take home message: your senses protect you. Don't ignore changes in vision, hearing, or speech. It will be a problem. Okay. So now we're going to move on. I said the brain and central nervous system and everything. Then I did the eyes, ears, nose, and throat and stuff. Now we're moving on to the heart and the circulatory system, the body's pump. This is the pump of the body, the entire human body. And the heart pumps blood through blood vessels to deliver oxygen rich and nutrients and remove waste. So it's the circulatory system. So, your heart is a big pump. And what it does is, the blood comes in with no oxygen and all of that stuff. And it pumps it through, its chambers of your heart. And it has a whole little thing that it has to do in a heartbeat. Boom, 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 and stuff. And that's your heart doing the process, and everything and doing what it's supposed to do. And each thank you, Rosie Granny Allen said, teach, nurse, teach and stuff. Thank you. I sure will and stuff. But saying that and stuff, the body is a pump, and everything. And the body needs to pump that blood. It needs to go all the way up to your brain and feed your brain and do everything it does to make you and stuff. But it also has to drop back down and feed you all the way to your baby toe, your pinky finger, your baby toe, and everything. Welcome on, Auntie Josie. You said you're at your grandson's game, but I'm watching. And say hello to everyone. Auntie Josie says hello to everybody. Yes, yes. Thank you, Josie. And good luck with your grandson's game and stuff. I got a cousin that's really my cousin and them. Shout out to Shamika and Auntie Linda and stuff. And I would call him Little Deshaun, but he Big Deshaun. He's a big boy and stuff. I think he's maybe 13 or something like that and stuff, but he's a player too. He's a baller. So he be getting on down. They probably be at the same games actually and stuff. But yes, moving on and stuff. So we're talking about the heart and circulatory system. So how to keep the heart and circulatory system working well and everything. And that's walk at least 30 minutes on most days. As many days as you can get in, even if it's every other day, but just try to build up to, if you can even walk 15 to 30 minutes every single day, you winning, and everything. And it's good for your heart and everything. So that part. And then eating low salt, low fat, whole foods, and stuff. Eating these good foods. Now my podcast for today was supposed to be on organics, and I was going to have my son Mike Jefferson come on and teach with me about some organics and stuff and give you some good information. I decided that I wanted to save that for our talk together with you and everything and stuff. So he'll be coming on most likely next Tuesday, and we'll be talking about organics and nutrients and different things like that. And we're going to dive deep in there, but we're going to try to keep it in layman's terms so that it's simple for you to understand. So I saved that for next week if I can and stuff. He's in a business meeting. I never stop the business and stuff, part of things and stuff. So that's a good thing and stuff. So in the meantime, we got to do what we got to do because we got to live. So also to keep your heart and circulatory system healthy, you want to try to control your blood pressure. If you got high blood pressure, let's do something about it. If you got blood pressure that's too low, let's figure out how to do something about it. But either way, we need to do something about it. We need to never play with the heart. You never play with the heart. You never play with your lungs, and so on and so forth. So that's where that's all coming from and everything. So then, so control the blood pressure, get it to the happy medium or almost there and everything. Then controlling your cholesterol. And so I know everybody's saying the Cheerios, Wheaties, and all of that type of stuff, but they all make sense now, and so let's control that bad cholesterol, and let's get some more of the good cholesterol coming in and everything so that we can be healthy and stay healthy. Because if not, it turns into other things and we will mess around and find out. So then we got and also sugar. Sugar got to do with diabetes. Oh, I'm pre-diabetic. Oh, I'm pre-diabetic. They're saying that you already are diabetic. Pre-diabetic means you are diabetic. I've been told I was pre-diabetic, but then I was told that I jumped on out of that and stuff. I was either going to go up and convert to full-blown diabetes, or I had to go down. I chose the latter. I went on down and stuff, but anybody can do it. And not just me because I'm a nurse and stuff. Anybody that wants to actually talk to your doctor and get tested for these things can find out and everything. So if that makes sense and stuff. So then, also it says don't smoke. Okay. And stuff. So we already know about that. We already had the smoke talk and stuff. Like I said, if you are smoking, this is no judgment by any forms. Let's see how we can slow it down to stopping, taking steps to stop and stuff. We got to develop a healthier habit if we're too stressed out, or if you're smoking just out of habit or something like that. Let's start breaking the habit, breaking the chain, on that and everything. That's what we're trying to do. So the age groups and the risk. So young adults, their lifestyle habits form during this time. So that means that I've been smoking since I was 17 years old or 18 years old and stuff. And here I am 45 and stuff. And I still smoke and everything. I don't smoke as much, but I'll be getting down and stuff like that. Well, that's a lot of years. So guess what? I wouldn't come up to you and say, even if it would save your life, I couldn't come up to you and say, girl, you need to just stop smoking. No, let's work on how we can get you to stop smoking. You see what I'm saying? Not you just need to stop smoking. I know you know better than that or something like that. Now, I'm not going to scare you. Every puff, your heart going to stop, no, and stuff. You got to, just like they built a habit over 15, 20, 30 years and stuff, they got to unbuild that habit. Hopefully it won't take that long, 20 more years, because we don't know if you're going to have that long and stuff. But if you have been smoking that long and stuff, then stop now, and stuff. And when I say stop now, I didn't say stop altogether. I said build the habit to work towards stopping, if that makes sense. Okay. And then for middle age, that would be your, I want to say 30 on up to about 60, and that would be working on that high blood pressure and stuff. And I even gave my testimony several times on different podcasts where I said that everybody was asking me, oh, your mother had some health issues and everything and stuff like that. How's that going? I'm fine. I got it. And I was lying. But guess what? I told on myself to my doctor, and I didn't even talk to the doctor to tell on that. He made me take, because you a nurse and everything and stuff, take your blood pressure right in front of me. And we're on a virtual, so I wasn't even in the office, and stuff. We on virtual. And I started to throw that blood pressure cuff. It just kept on saying my blood pressure was like 150 over something. And he's like, yeah, okay, so take it for this many days, and then send me a note of what it was at this time every single day and stuff, and I want to see what's happening. He had already called the medicine in and just started me on a low dose, which, and when I feel like I don't need it no more, and I'm not lying to myself, talking about I'm okay, and stuff, because I am a human being and stuff, then I'll get off of the medicine. But for right now, I'm gonna go ahead and deal with it, and stuff, as long as I feel like I get stressed a little bit too much and stuff. So that's the whole moral of the story. Miss Brittany said, but you know what? Yeah, I know that and stuff. We talked about it and everything, but thank you, Miss Brittany and stuff. So what else did I want to say? Also in middle age, you're set up for heart disease. That means coronary artery disease. That means clogging up the arteries that feed that good rich blood and oxygen to parts of your body to keep you healthy and stuff like that. It starts cutting off. The heart don't get the blood that it needs to keep pumping, and so if it stop pumping, you stop living. Yeah, even if the heart stop, you stop living. If you stop breathing, you stop living, and stuff. So I'm just saying, and that's where that comes in at. And then also with older adults, you're really at risk and stuff. Now, these healthy ones that have a 18 pack or 6 packs and all of that stuff, okay, y'all go ahead and work it out and stuff. But if you're an older adult and you know that you haven't really been getting on down, and being super healthy and stuff, that's where this comes in at, because it sets you up for a heart attack or a stroke, which is called a brain attack. The heart attack is because it attacks your brain. I mean your heart, and that part of your heart that it attacks, that part dies. That didn't get the nutrients because of a blockage or something. For your brain, what part of your body that doesn't get the blood because there's a blood clot there and stuff like that, that part of your brain dies, and they'll always be able to see it and everything. So it's really important. And so another quick myth versus facts. Heart disease only affects men. Okay, that's the untruth. It affects human beings. But anyway, it is the number one killer of women also. Meaning it doesn't matter if you're a man or a woman, it affects a human body. So that's all we're talking about. We're not interested in all the other stuff. And the take-home message there is, what you do daily determines your heart's future, your heart and circulatory system future. Okay. And so the next one is lung and respiratory system. So what I'm doing is a head to toe blueprint of your body. And I'm breaking it down into a quick little, something for you. And so the definition: the lungs allow oxygen in and carbon dioxide out, supporting every cell in your body. So the lungs bring in the oxygen, and the oxygen travels via the blood and everything and gets into the cells that it needs to do, and feeds all your organs. It feeds the kidney, the eyes, the brain, the heart, and all these things on your body and stuff. Your skin is actually an organ. And so these are all organs of the body, the human body and everything. Welcome on in, Miss Madeline. She said, good evening, everybody. Good evening, my dear. We talking about the human body. So I talk about all the other stuff and everything, blood pressure, strokes, and diabetes and all of that stuff. Let's talk about the brain, the whole head to toe of the body and stuff, and how we got here, in the first place, and why we talk about all the other stuff, because it got something to do with this. So I'm on lungs and respiratory system. And it's called the breath of life, because no breathing, no aliveness. I don't even think that's a word, but I'm gonna use it tonight and stuff. Your body is a snitch. Okay, so getting back to it and stuff. Um, the I'm giving you age groups for, respiratory stuff. Because we're talking about lungs and respiratory system, and children. One of their biggest deficits would be having asthma. They can't play sports or something like that because they got asthma, and stuff. So that's a bad thing, and stuff. Not bad for the child. Nothing's wrong with the child. It's just that, if they have asthma or unfortunate enough, they have to be careful, and stuff. And they can't run out there like everybody else and go willy nilly. They got to be a little bit safer about what they do, because whatever's happening might trigger that asthma attack. And then they're the ones running around. You see them in the movies and stuff like that, and they run around with that little inhalers squirting to get a rescue breath and everything. And it really doesn't work like that and stuff. And it really does work when they fall out and they going crazy and they starving for air. That part is really true and stuff for any age, and everything. So that's for children. For adults, it's the smoking related diseases like COPD, chronic obstructive pulmonary disease, and stuff. And a lot of times it comes from smoking, and everything. And when it says obstructive, that means something is in the way of you breathing properly. So it's a problem. Everybody needs to breathe properly. So whether it's asthma or COPD for an adult, and stuff, it needs to happen. And then also older adults, they get COPD, but they also get a thing called pneumonia. And just like COVID and just like a stroke, leaving a scar on the brain, heart attack, leaving a scar on the heart where the heart dies in that area and stuff. For pneumonia, it leaves a scar on your lungs like COVID. Every time you get COVID, it's going to leave a scar. If you've ever been positive for COVID, it left a mark like I was here. It did a little graffiti on your lung and everything. So that's what it does. And so myth. This means an untruth. Shortness of breath is normal with age. The fact is, it should be always evaluated, because you shouldn't just be walking around short of breath. Why? What you got? What you don't have, and stuff like that. So it shouldn't, that's a problem, just period. Anything that's stopping you from breathing properly, that's a problem and stuff. And it should be looked at by a doctor immediately. It's 911. Anything affecting your breathing and stuff. You go to sleep and you have that, what is it, sleep apnea, and you stop breathing several times a night and everything. That's a problem, because one day you might stop breathing and you gonna keep on with that same thing, and you're gone, and stuff like that. So that's a problem. It needs to be looked at so that somebody knows, because it's always help can be on the way if you reach out for it. Okay, so the take home message: if you can't breathe well, nothing else works well. And that's as simple and easy as it gets. But if you're not breathing at all, you're not alive at all. If that makes sense. So that part. So then we're moving on to the digestive system. And it's called the fuel processor. I'll let you know what fuel means in a second. This system breaks down food. Food is fuel. So this system breaks down food into nutrients and removes waste. Okay? So that means it breaks down your food that you eat. It takes what it needs to help, fix the body up and everything and stuff. And then it pushes it on in until it get down to the colon and rectum and stuff. And it come out as a turd. Poo-poo. Okay? I ain't gonna say stool. I ain't gonna say bowel movement, because those are special words. Some people know what they are. Some people don't. Boo-boo. Dookie. I don't know. But yes, that part. Okay. So the take home message. Oh, okay. No, it says digestive system. It says the system breaks down food into nutrients and removes waste. How to keep it healthy. That's the part I was trying to get to. Sorry, you guys. And that is eating fiber rich food, period. Food with fiber. It's usually something really nasty, in my opinion, but do it. So get it done. And whatever that looks like and everything. What is it, whole wheat breads and stuff like that, instead of the white processed bleach and different things like that, and so on and so forth. I don't want to step into my organics yet and everything and stuff. So I'm gonna scoot on away from that. Drinking enough water. Water don't taste like nothing. It's so nasty. Well, put something in it then until you can figure out that what you need water and stuff. And when your lips start sticking to your teeth and and all of that stuff, you'll figure out that it's a problem, and stuff. So drinking enough water, stay hydrated. This is how you keep yourself healthy and keep your gut healthy and stuff. Limit processed foods. Who said them little Kraft single slices was real cheese? Find out what's in there and stuff. And then I want y'all to come back on and stuff when I come back on next and stuff. Let me know what y'all get and stuff. And we're going to find out. That's called a processed food. Other things that are processed is like our meats that we eat. Like, I'm going to get me a turkey sandwich, and stuff like that. Well, what turkey look like that? It look like ham / turkey / this and that, and you can't even tell the difference. Yeah, find out. Look at those ingredients and find out what's really in there and stuff, and then come back and tell me about that and stuff. I'm deputizing all my nurses out there, future nurses, and then also managing your stress. Not with another substance that's going to take you down and stuff, but managing it by living healthier, eating cleaner whenever you can. It's not an overnight thing. It took you all these years of umpteen years or however old you are now to get to this place, and stuff like that. So it's not something to break you down. It's something to just try to turn it around. Let's hit a reset. We said we was going to reset in January for, New Year's and everything. Let's hit a reset, even on our food and what we put in. I know I'm doing it. And I didn't wait till January. I already started last year when I messed around and found out that my mother had some health problems and stuff. I started then. It was called starvation. It was wrong. I don't recommend it. It's not fasting. It was just called plain old starvation. And I just stopped eating, and stuff. And it's not a good thing and stuff. So don't try it. I don't recommend it. It's horrible. Okay. So then I'm going to just skip on to myth versus fact. Myth. Daily bowel movements are required. That's an actual untruth. I thought you supposed to poop like 3 or 4 times a day. And I was like, yep, I'm out of that, and stuff. I just can't push it out. But however that was. But I'm saying that to say that, this is a real thing. Remember, I'm figuring out my body too while I'm talking to you guys, and stuff. This is a good thing. This is about human beings. It doesn't matter. I'm a girl and y'all, some are guys and everything and stuff. It matters that you got a body, a human body, and stuff. That's what we're trying to get to, the end of that and everything and stuff. So it says a normal bowel movement varies by person. Okay, I feel a little bit better, but not all the way and stuff. But a bowel movement is good if you can go every day. That means you're getting that fiber in, you're getting that hydration, drinking that nasty water that doesn't taste like nothing, and all that good stuff. But at the same time, eating those well-balanced meals and stuff, fruits and vegetables and everything. That's why they say it, because they know that it's easier for the body to pick through and get all the good stuff out of it and stuff. And then, send it on down to Turdville, and stuff where you eliminate it. after that and stuff. And it's just as simple as that, but we make it hard with ice cream and cake and Snickers and stuff. Um, when the last time they had some real good stuff? I'm not one. I'm not judging because I had a Snicker before in my days. Maybe more than I should. Reese's cups, Twix, Kit Kats, and stuff like that. I get it and stuff. What I'm saying is, let's reset today. Let's just start changing a little tiny bit, just a little tiny bit, 1%, and see what happens and everything. So it helps you. So the take home message: your gut health affects your whole body, including mood and immunity. What's immunity? I'll be speaking on it later. Okay. Now we're moving on from the digestive system because I said head to toe. We started at the brain and central nervous system. We moved on to the eyes, ears, nose, and throat. We moved on down to the lungs and the respiratory system. We hit the digestive system and the intestines, gastrointestinal system, and all of that stuff. And moving along, we got the liver, pancreas, and metabolic system. And that is the chemical factory of your body. The chemical factory of your body: liver, pancreas, and metabolic system. And these are organs that regulate blood sugar, detoxify chemicals inside your blood, and manage energy storage. They're very important, especially the pancreas, which supplies the hormone insulin, which is what you need so that you're not diabetic or pre-diabetic or anything and stuff. You need a healthy functioning pancreas and everything. So that's why they're so important. The liver, you heard of liver cirrhosis and stuff like that. The liver detoxifies the blood. So you need that to be acting right. You know what I'm saying? And you need to be able to metabolize your food, break down your food and process your food. And this is the chemical laboratory of your body and everything. And like I said, these organs regulate the blood sugar, detoxify chemicals inside your blood, and manage energy storage. How to keep them healthy: limit alcohol, maintain a healthy weight, meaning you can't be overweight or morbidly obese. My 600-pound life obese, and stuff like that. You can't get up that far. A lot of us are, a bit overweight, different degrees and stuff like that. But trying to control it, and starting now is reset, not judgment, not, oh, you did this and you didn't do this and stuff. Nope. Just reset. Let's just start. Don't even tell nobody. Just make a start, make a change. You by yourself when you make most of the decisions to figure out what you're going to eat, and stuff. Make a change. Okay. Also controlling your blood sugar, diabetes or not, and stuff. If you control it, because sugar is good for the body, it gives you energy. So it's good. Sugar in excess, meaning more, not one piece of cake, the whole cake. That's the difference. Did you need that whole cake? And stuff. So that's where that comes in at. Okay. And so let me see. Myth versus facts. I like doing these and stuff. So myth or untruth: only alcohol damages the liver. The fact is, sugar and obesity do too. Sugar and being overweight does also damage your liver. The detoxifier of your body is a blood detoxifier, one of many and everything and stuff. So you see that? So the take home message: blood sugar control protects nearly every organ in your body. When it's out of control, it goes and wreaks havoc. It doesn't stay in its lane, and it's touching everything that it's not supposed to because it's running wild. and it's nosy and it want to touch stuff that it ain't got no business touching. And that's why we have all the problems we have with the strokes and the heart attacks and the coronary artery diseases and so on and so on and so on. All behind that. Sugar in excess, not sugar itself. Okay. This is over time. So that overweightness and everything else and stuff, they all build it up and stuff and cause problems. And next, so we did the GI system, digestive system and everything and stuff. So the next one would be kidneys and urinary system. These are our filters. These are our cleaners and stuff. Mr. Clean and stuff. That's what I call kidneys. And kidneys have a byproduct, and it's called urine, pee. So your kidneys clean the blood, and then the trash that it gets from cleaning the blood or filtering the blood and stuff, it sends it out into your bladder and everything from your kidneys to your urinary system. And part of your urinary system is your bladder and stuff. And so therefore, the pee, if you leave it inside, it will try to kill you. And how do I know that? Because I had became an expert with my high paying, beautiful, wonderful job that people will work 18,000 hours a day and stuff for and everything. Guess what? I didn't want to be there 2-3 hours after my shift is over and stuff. I wanted to go home like normal people go home and stuff. So guess what? I would rock and chart and rock and chart. And after a while, I didn't have to pee no more. But if pee is like poop, and stuff, it's trash of your body, and stuff like that, it need to come out, right? So if it stayed in, what's happening? And if you didn't know where to find it at no more because you didn't rocked and didn't take care of yourself and stuff, what happens? Yes, I found out. I faced around and found out. And that was called urinary tract infection. And even one time, a kidney infection. Yep. And guess what? Anybody can get it, a man or a woman nurse or a male nurse. It doesn't matter who you are, just being a human being with human being parts. That's all it takes. Granny Rosie said, my, Jesus help us. Jesus help me and stuff. I fixed it. It wasn't easy because that was years of rocking, go stopping until it didn't want to come out. And it got a little special. So saying all that to say, don't torture yourself. You only get one of you. What if all my stuff stopped working? And stuff. Then that would have been another problem. And stuff. So I had to research and figure out and talk to my doctor and tell her everything and how I did this and how many sodas I drank and all of that stuff for us to get to the bottom of it. Do you want to live or die, Charlene? Okay. I'm alive. That was years ago. But I faith around and found out. Okay. So because the kidneys are the kidney and urinary system is the body's filters. The kidneys filter waste and control fluid and blood pressure. You hear that? The kidneys. Why is it messing with my blood pressure? Ain't that the heart or something like that? They're all connected. They're all in you. Okay. So then how do I keep my kidneys and the urinary systems healthy? Stay hydrated. But water don't be tasting like nothing. Why I gotta drink that? And you talking about 4 to 6 bottles of water every day and blah, blah, blah and stuff like that. And I don't even like water like that and stuff. It better be cold. It want me to have it and stuff. Well, I don't care how it is and stuff. Just make it happen. And try not to. I tell you one thing, it's really not water and soda. So soda is just soda, and everything and stuff. you can even do a little taste test where you take the soda, pour a little bit in the cup, and then let it dry out or something like that, or leave it somewhere, like a cutting board or something like that, and just pour a little bit of soda on the cutting board and just let it sit out all night long, and then look at what that is, that shiny little material that turns into like a glue, and then you'll see what sodas actually do to us. Do I still drink soda? Because I grew an addiction for it. But do I drink less and be more conscious and put more water in so that I'm balancing out the soda with some water so that it won't be so bad? Absolutely. Do I hold my pee in and rock and stuff? Heck to the no. I'm going. I don't care where it's at and stuff, so the whole moral of the story is you can change anything if you want to take care of your health and you love yourself enough at the end of the day. Okay. So also you got to control your blood pressure. That means telling on yourself like I already did me, or you gonna do you and stuff, and making sure that you be conscious of your diabetes or pre-diabetes or some, try to move towards the non-diabetes and stuff, because you can actually do that. All you have to do is cut down some things. It get a little rough and stuff for a minute and stuff, but they're coming out with so many good things that it'll work itself out. Juicing and different things and natural stuff, and it'll help you out. And then also avoid overuse of pain medication. Remember, I told you after the surgery or after the accident or whatever and stuff, and you was taking them pain medicine, don't just keep them around and just keep on taking them. And now you didn't develop a whole nother animal, and that's called addiction to pills. Now you searching doctors to try to see which one gonna give you the most Norcos or Percocets or whatever else they got out there, morphine pills, Oxycontin, Xanax, I don't know. But anyway, whatever the pill is, and stuff like that, avoid overuse of them, because you do develop a tolerance, and then next thing you know, it's breaking you down, because they're not there to heal you. They're there to kill you, to kill you, complain about you in pain, and everything. So that's where that is. So myth: kidney disease causes pain early. That's false. It is often silent, actually. The fact is it's often silent. So it doesn't show you nothing and everything. Thank you. Rosie Granny Allen said, pray, pray, pray. Absolutely. And Brittany said, yes. Okay. Thank you, ladies. And then the take-home message: protect your kidneys before damage is done. Meaning you got a chance. Everything I'm talking about, you got a chance of turning it around. But you got to just start. That's all I'm asking and everything. So the next body part and stuff: bones, joints, and muscles and stuff. It might be somebody on here that knows a little bit about that and stuff. And that is that that what they do is they support movement, they protect organs, and they store minerals. We need minerals, vitamins and minerals, and stuff. I know you heard that saying and stuff, and how to keep them healthy. Different weight bearing exercises. You got to keep moving it, or you basically lose it. If you stop moving it, you lose it and everything. And it's so hard to try to come back from nothing, and everything. So those chronic wheelchair, they'll probably be in a wheelchair for the rest of their life unless they start trying to turn it around now. So it's very important. But also it'll help you prevent falls, and stuff. You gotta, in order to be healthy, you gotta have everything together so that you can prevent things like falls and things like wasting away, like not being able to use these things. Get up and move it no matter what and everything. Let me see the take home message. Motion is medicine. Use it or lose it. Meaning, if you don't move it, you're going to lose it. Okay. And so, this is the last one, you guys. And then give me about 10 minutes altogether and I'm done and everything. I'll get you guys out of here. And that is your immune system, because I gave you a head to toe blueprint of your body and all the parts, all the things that's important, which is you. And one is the immune system. This is your fighter cells. This is the defense system of the body. And it's called the immune system. And the immune system protects the body from infections and disease. How to keep it healthy? A balanced diet, adequate sleep. So getting towards that 7, but you need up to about 9 to really, really reset from this world and what's going on. And it's not as easy as it used to be years ago and everything. Vaccinations. Girl, I ain't getting no darn vaccination and stuff. I got the flu shot, and next thing you know, I had the flu. Did you even check before you got that shot to see if you already came in contact with somebody that had a cold? And you gonna call it? They don't care about. They don't love you enough to give you, infect you with what they're trying to get you rid of and stuff. This is muscle memory for your body, your immune system. Your immune system fights. It has these things called white blood cells that fight when they get something in there. So when you get a shot and it be hurting, that's because your white blood cells is going up there. So now it's kicking the whatever foreign body, that little shot that they shot in you, that's foreign to it. So it's going to attack it. So this is what happens. They give you a derivative, dead cells of something like COVID or flu or whatever, pneumonia and stuff like that and stuff. And so that goes in there. That gives them a memory. So when the flu come around, you get the flu, you didn't already had a shot and got, vaccinated for the flu. So first of all, your flu will be less than somebody that didn't get no shot at all. It's only very few, like some people could be allergic to it or their kids could be allergic to it. Okay, be it as it may, but then you're going to run up on something and stuff. But the other part of that is it's remembering. So when it comes back, you catch COVID, but you got your COVID vaccine and stuff. When it goes back up there and it sees, oh, you're not the COVID I fought before, but I kicked its butt, I'm going to kick yours too. And stuff. And then that way your COVID, when it comes time for you to have caught the COVID or something, because it ain't gone, you guys, just because they don't talk about it, that don't mean it's not gone and stuff. But the good part about it is now your body at least can put a whoop butt or a double L on that, and stuff. And I'm saying all of that to say that this is the real deal. This is the real deal. Thank you, Brittany. What else did I want to say about that? That was the immune system. It protects the body from infectious diseases. The myth: supplements replace healthy habits. That's a myth. Okay. Fact: lifestyle matters most. Change in your lifestyle, that healthy diet, that not eating in excess, sugar, salt, or otherwise and stuff, not breaking down your body, exercising 1% every day, changing it around, smoking cessation, alcohol cessation, calming down and stuff, not every day. And then after that, not every week and stuff. And then after that, every other month, and stuff like that, until you can, do it responsibly without overdoing it. It's just like a shopping addiction, and stuff. You might lose this one and pick up this one and stuff, but which one is the healthiest? Which one will be at detriment to your body and your well-being and everything? So you got to pick a motive and everything. So as I end this final part of the live and everything, it's let me see. Oh, this is the one I want to put up. Okay. So as I ended and stuff, the take home message: strong immunity starts with daily habits. Okay, that's one of your take home message. Is the strong immunity starts with daily habits. The final take home message, head to toe: your body is a warning system and a gift. Symptoms are signals. Symptoms are snitches. Symptoms are signals, not annoyances, not they get on your nerve. Prevention, early care, balanced living, faith, and self awareness keep the body functioning well across the lifespan. And from me to you guys, your body talks. Listen early, act daily, and protect it for life because your life depends on it. Okay, you guys? So I am at the end of my podcast. So it looked like I'm be doing an hour and 30 minutes sometimes and everything and stuff. But saying all of that to say that I appreciate everybody that takes the time out of their day and their busy schedules and everything to hop on to catch a little bit. If you came on late or you came on and you didn't catch the whole thing, you know, the head to toe and everything, there's nobody out there doing this and everything. That's why I felt the need to be able to come in knowing what I know and stuff. I can't gatekeep. I can't just keep this to myself and hold on to it. It does help me and my family and stuff. Don't get me wrong, but what if I help you and your family? Because half the people that come on here, they're already my family or some extended family or so on and so forth and stuff. They ask me anyway. Why not come on here and give it to everybody? And then you guys become ambassadors and give it to your family or get them to come on and everything and stuff. So I'm streaming live right now on via Facebook Live under Charlene Nurse Allen, and then also simultaneously with YouTube under Medical Talk in Layman's Terms with Nurse Charlene. And then I'm opening up to a couple other different platforms, social media platforms. I'm working on that now and stuff. So I'm just getting the feel of everything and stuff. But as I go along, you'll see it's more to come and it's more things to come, like these guest speakers. You know, I have Nurse Charlene gear, you know, and stuff. And, you know, I do things like sweatshirts and totes and t-shirts and hats and all types of stuff. I have pillows, you know, and stuff like that. Just all types of little fun things and stuff, but they all have that thing. Your body's a snitch, believe it. It's just a reminder. That's going to be our anthem, you know, and stuff. Your body's a snitch, believe it. Let's start a movement, you know, of getting our bodies healthy. Let's start listening to our bodies, because if we listen to them, we protect them. It's better than any gun. It's better than any mace. It's better than any enforcer, you know, and stuff like that, as to actually take care of yourself, you know, and everything and stuff. So let's start getting this stuff done and everything. It's just so much that we need to do for ourselves, and we need to love ourselves enough to know that we deserve every bit of care, every bit of love that we can provide ourselves and everything. And let's get on the other side of this unhealthiness, you know, all of us. I'm willing to take the trip if you guys are, you know, and I'll take the trip with you. But by no means, this is the most important thing. Not just me, but I'm saying this is the most important thing, is to get knowledgeable about your body and taking care of you, so that you don't just suffer through life day after day and all the years that you messed up, being messed up, you know, and stuff, when you could be getting that healthy person and stuff that you see. They just doing that and stuff. That's just AI. That's just social media and stuff. They don't really be looking like that and stuff. We don't know if they is doing that and stuff. I might not feel too bad about looking like that, and stuff. So I want to do that too. I want to, stay forever young. I want to stay, healthy. I want to get myself together. I want to have a good quality of life. I want my loved ones to have the same thing. So at the end of the day, if you didn't hear nothing else, take care of yourself because your body is a snitch. Believe it. Okay. Y'all take care, and I'm going to end my live. Thanks for everybody that came on. I do answer things after the live is over and stuff. I'll go back in and write my opinion. So if you want to see something or you missed something, that's totally fine. But y'all take care and take care of each other. All right. Thank you.